And Dr. Shivam Gupta. Okay, okay, let's go with Dr. Shivam Gupta and then we can come back to Dr. Naila Aftab. Clinical and surgical outcomes of Sturge-Weber syndrome. I'm going to have dreams of Sturge-Weber syndrome tonight.
So, very good evening to all, and so we are going to discuss today about clinical course and management of patients with Sturge-Weber syndrome. So, as we know, glaucoma presents around 30 to 70% patients with Sturge-Weber syndrome, and approximately 60% of patients present with glaucoma at birth, and 40% manifest glaucoma later in life. Management glaucoma in patients with Sturge-Weber syndrome is a complex because of its early onset and resistance to conventional therapy. So, our aim was to evaluate the treatment of clinical course of Sturge-Weber patients who visited glaucoma clinic. So, what we did with a 3-year study in the glaucoma department, and we discussed about what are the outcomes of it. So, basically we recorded the age, gender, side and the phase of involvement, whether it was unilateral or bilateral, how was the brain involvement or any CNS involvement, anterior segment details, posterior segment examination, and then we recorded what are the total number of patients, how many of them had glaucoma, how many had required surgical management, and whoever had the surgical management, we went out for the 6-month follow-up to look at the IOP control. So, our results showed there were 26 patients or 26I, and females were more than male with 65% predominance. Age of presentation, we had a varied age of presentation from 32 days to 68 years. Associate features were seen in 26.92% with radiographically significant findings. Other syndromic association was one patient had Klinefelter, one had phacomatous pigmenta vascularis, one had neurofibromatosis. Face involvement 65.38% had left eye and 30.76% had the right eye, and 3 patients had oculomotor nevi. Then results show that prominent eye episcleral vessels were present in all the patients. Blood in Sturge's canal was present in 19.23%. Posterior segment involvement in form of dilated tortuous vessels were present in 10 patients, and choroidal hemangioma were present in 11 patients. So, coming on to glaucoma part, around 88.46%, that is 23 eyes had glaucoma. Coming on to management, 4.7% were medically managed with mean 2 AGMs, and 65.2% required surgical management. Coming on to surgical management, we did a combined trap for 14 patients. Primary AGV was done in single patient, and of course, there was a repeat trap out of these patients, and there was a repeat GDD, 1 AGV and 1 RD implantation, and there was significant reduction of mean IOP and mean number of AGM. Coming to this, total reduction of IOP being 69.84% at the end of 6 months. So, as we discussed with the other previous done studies, there was our data was comparable to them with a little more sample size, and they had shown a 41.7% success. And so, to conclusion, glaucoma is a common occurrence in Sturge-Weber patient, with the majority patient will need surgical intervention. Trabeculectomy combined with trabeculotomy should be the first surgical choice, considering good IOP control. Thank you.
Okay. Very nice. I like the study, but I would like to know what are the complications that you have encountered during the surgical intervention of these patients, because they are known to, they are more prone to complications as compared to other.
Yes, ma'am. Definitely, one patient we were aborted expulsive. We had an aborted expulsive.
But you had one expulsive?
No, okay. Ma'am. We were feeling that we might go aborted expulsive, so we stopped immediately. We called the patient after 6 months, and we did we went with the valve implantation for that patient.
Okay. Others, any other thing?
Bleeding excess was there, ma'am, but it was well controlled, not any significant, ma'am.
Okay. So, anything else you'd like to ask?
Sir, I would like to add.
It's all right. You didn't go for mitomycin C.
Mitomycin, yes, sir. We definitely give mitomycin C for
that you have not mentioned.
Okay, yes, yes. I didn't mention the surgical steps. I missed it. Sir.
Okay.
So you did get a lot of cases of this comparatively rare disease.
Sir?
Yeah.
That's true.
It's a rare disease.
3 years, I guess. It was
3
a
years.
prospective
a long,
3.
Yes, sir. 3 years.
Long study with a
yes,
with a follow-up for outcomes. Okay. Thank you, Dr. Shiva.
Thank you, sir.
Now,
Thank you.
now coming back to Dr. Naila Aftab. Presentation, Systemic Association of Congenital Ectropion UVA.